stop these threats close to the source, which benefits all of us by decreasing the likelihood of disease threats reaching our shores. So thank you for the work you do every day to protect the public's health in your country, your region, and around the world. Your vigilance and detection and dedication are crucial to help us fight threats such as measles, Ebola, HIV, polio, and the COVID-19 pandemic. These are complex outbreaks that are hard to beat, but we can beat them, and we must. So we are grateful to be able to get together in person again so that the FETP residents and graduates can share with us the tremendous impact their work has had to protect the world. Thank you again for all you do. It's great to be here tonight.
Before our next speaker comes up, thank you so much, Dr. Huri. I've been notified that we have someone very special in our midst, and I think it links very much to what FETP means is not just here at CDC, it's actually meaningful to the country. So we actually have a Minister of Health in our midst. And this is Dr. Larson Alex from Haiti, and we just want to acknowledge your presence and thank you for the support that you've done for FETP. Dr. Marianne Delia will provide remarks from the Carter Center.
Thank you so much for the introduction, and good night. It's an honor to be here tonight to provide opening remarks for an event that celebrates the impact of field epidemiology training programs on global public health. Tonight, epidemiologists, laboratorians, public health practitioners from around the world will share their work, network, and celebrate special achievements. While many of us come from different countries, backgrounds, and cultures, we all share a common passion for investigating patterns and causes of disease, injury, and health conditions. We also share a belief that we can make the world a better and more just place through the work that we do. Our recent experiences with COVID-19 also highlight the need for better preparedness and response to prevent future disease outbreaks from becoming epidemics and pandemics. At the Carter Center, we aim to wage peace, fight disease, and build hope through our health and peace programs. The Carter Center is a non-governmental organization that was founded in 1982 by former US President Jimmy Carter and former First Lady Rosalind Carter as a nonpartisan, neutral organization that has since helped improve the quality of life in more than 70 countries. The organizations work with governments on peace programming that touch on democracy, human rights, conflict resolution, and rule of law, amongst others. The organization also works closely with ministries of health and other relevant line ministries to address mental health and neglected tropical diseases in the hardest to reach and most difficult places that are often otherwise left untouched. Our neglected tropical disease portfolio includes programming on guinea worm, trachoma, river blindness, schistosomiasis, soil-transmitted helminthiasis, and malaria. The International Task Force for Disease Eradication was also formed at the Carter Center in 1988. Given our work on peace and health, we acknowledge the need for peace to facilitate health and for health programs to be used as a negotiation tool for peace. This recognition serves as a foundation and cornerstone for the Carter Center's Peace Health Initiative. Since former President and Mrs. Carter founded the organization with input and advice from Drs. Bill Foege and Don Hopkins, there has been a special relationship between the Carter Center, the CDC, and the countries in which we support peace and health programming. One program that's especially close to President Carter's heart is the guinea worm eradication program. Guinea worm disease, also known as dracunculiasis, is a parasitic infection that's affected people for thousands of years. Yet, to date, at least now, maybe in the future this will change, there's no vaccine or therapeutic available to prevent the disease. In 1986, the Carter Center assumed the role as the lead of the guinea worm eradication program, and at that time there was an estimated 3.5 million cases in 21 countries per year. Through a concerted global effort, we've seen reductions of 99.9%, with a staggeringly low 13 human cases of disease detected in 2022. These advances are not easily achieved, however. They require trekking into endemic villages that are off the beaten path and constant follow-up of mobile communities. They require strong surveillance systems that are sensitive and can detect all cases of guinea worm. When I was working in South Sudan, my most endemic village was 5 hours up a mountain, and sometimes I had to visit there twice per week to follow up with program interventions, to help the team do case investigations, and to ensure that community members who had guinea worm or signs and symptoms of guinea worm were followed up closely. My team and I also had to oftentimes hike up to 12 hours to go out to cattle camp to ensure that the communities that were moving to those areas were also being followed closely to ensure we weren't missing any signs or symptoms of guinea worm and no cases either. The eradication endgame is not straightforward, however. As the program was drawing near its goal of global elimination or eradication of the disease, our program staff and epidemiologists detected guinea worm infections amongst domesticated dogs in 2012, and a year later in domesticated cats. In subsequent years, we've seen cases in baboons and other wild animals. Since 2015, there's been more guinea worm detected in animals than humans. And while non-human definitive hosts pose challenge to the eradication efforts, our program staff and epidemiologists continue working with national guinea worm eradication programs in remaining endemic countries to use shoe leather epidemiology to investigate cases and identify and interrupt focal points of transmission. And through that effort, we've seen annual reductions on average of more than 34% in all hosts since 2020. The Carter Center and CDC provide technical backstopping to national guinea worm eradication programs and invest in capacity building to enhance the capacity of local partners and community stakeholders to conduct active surveillance and make strides to contain all cases and infections and ensure rigor in guinea worm investigations, while also performing high-quality data collection and analysis, and most importantly, using data for action. As we continue to run the last mile of the eradication endgame, which is often the toughest part, and given the need for shoe leather epidemiology to investigate lines of guinea worm transmission, we feel that FETPs may be well suited and positioned to assist guinea worm eradication efforts and strengthen local epidemiological capacity in the countries in which the Carter Center works, both during and after graduation from the program. In guinea worm endemic countries, as part of the FET experience, for instance, fellows may be able to assist with data-related program needs and assist with investigations. And upon graduation, FETPs may be well-positioned to apply for technical advisor or research associate positions with national programs. There may be other opportunities as well as graduates go on into government-line ministries or universities for additional collaboration on programmatic initiatives and research with the program. So in closing, and as we move forward tonight to hear more about the important work being done under the auspices of field epidemiology training programs, please bear in mind that while science is important, striving towards excellence in global public health takes political will, access, and funding. Addressing the humanity behind diseases and health conditions that we collectively support is one of the reasons that President Carter and Mrs. Carter are so passionate about the work in global public health. Behind the numbers that we as global public health community track so closely are the people whose lives we are meant to enhance. Let that be our drumbeat as we continue along as a global community of epidemiologists. Thank you.
So are we ready for some posters, oral presentations? So my colleagues from our FETP Field Epidemiology Training Program team and the Evaluation Policy and Innovation and Communication team, they're going to be coming up to lead the poster session. John?
Thanks, Dr. D'Elia, for that presentation. We appreciate the support of the Carter Center and look forward to continued collaboration. Good evening. I'm John Watson. As Seymour said, I'm the unit lead for the Epi-Technical Support Unit on the FETP team. And now we'll transition to sort of our main event for the evening, which is the poster presentations. TEFINET received, I think as Seymour mentioned, almost 200 abstracts from 57 countries. The abstracts were each reviewed by 3 reviewers, so we certainly want to thank and acknowledge the time and effort that went into bringing us to where we are here tonight. So tonight we have 22 posters, and from a broad range of topics, of activities, of modes of transmission, and of settings. And interestingly to me, 3 of the 22 posters cover events or outbreaks in prisons. I think what we can gather from the broad range of these posters is the value and the utility that FETP brings. The willingness, I think, of FETP residents to go anywhere, do anything, do what needs to be done to improve public health is truly inspiring. So without further ado, I'll hand over to my colleague, Dr. Reina Tercios Ruiz. Thank you.
Let's make this height appropriate. Good evening, everybody. Reina Tercios Ruiz, it's an honor for me to be with you today. Let's start with reminding you that tonight's event is being live streamed on TEFINET's YouTube channel. All of our speakers and poster teaser presentations will be live streamed. If you're viewing online, please visit the digital poster gallery after our live stream has concluded. The link to the digital poster gallery is on the video presentation. We're going to proceed with some teasers where the presenters are going to come up for a period of 2 minutes and entice us to come to view the posters. At the conclusion of the poster teasers, please join us in the poster hall through the doors in the back to Ravinia FG. Our event staff and volunteers will help direct you to the poster hall. Anyone joining online may again view those posters on the virtual poster gallery. All right. So ahead of time, I beg your forgiveness if I don't pronounce your name accordingly. Mea culpa, mea culpa. So let's start off this whirlwind tour with the assessment of risk factors associated with diphtheria outbreaks in different areas of Pakistan, September to November 2023. 2022, pardon me, a case control study. Dr. Wakar, welcome.
Hi everyone, I am Dr. Wajiha Wakar Ali from FETP Pakistan. As you all know, diphtheria is a re-emerging public health emergency, public health issue in low-middle income countries, and Pakistan is one of those countries which have been affected by diphtheria outbreaks in the last year, that is 2022. Public health laboratories, which are located at National Institute of Health, Islamabad, have received several samples for diphtheria confirmation from all across the country. during September to November 2022. In order to assess the risk factors associated with the diphtheria transmission and to recommend public health measures in order to contain the current outbreaks and provide recommendations for prevention of similar recurrences in the future, we conducted a case control study. Control study cases were defined as those individuals who belong to any age group and are residing in Pakistan and whose samples have found out to be positive for Corynebacterium isolation, along with confirmation of toxigenicity through phenotypic ALEC test. For each case, 2 controls were matched by age, sex, and geographical area. Data were collected through interviewing of cases and controls, and frequencies and attack rates were calculated, and association between risk factors and disease outcome have been established by bivariate analysis through EpiInfo version 7.1.2. Now, if you want to know that what was the most affected age group, what was the most affected district in Pakistan, and what were the main driving factors that contribute towards the disease transmission, and what public health measures have taken by the district health authorities in order to contain the current outbreaks in their respective jurisdictions, and what were the future implications for preventing similar recurrences in the future. Kindly, I am very obliged if you will come to my poster, which has been displayed at slot number 1 in Ravinia FG. Thank you for your patience.
Dr. Wakar, let's go ahead and give you your certificate, if you don't mind. I'm sorry? No, they're supposed to be getting them as they present. Okay. I'm so sorry. We're going to move just a little bit. Okay. Apparently it's going to be at the end. Okay. Thank you so much. Our next presenter Dr. Khalid Al-Dawhli. Oh, got one right. Thank you. Welcome. You can advance the slides right there.
Okay. I will see the slides there. Can I go back? Already, okay. So, good afternoon, good evening, everyone. This is Dr. Khalid Al-Dawhli from Saudi FETP. My poster will be about a challenging outbreak of measles among prisons inmates in Mecca, Saudi Arabia, started from September, October into 2021. Actually, on 10th of October 2021, the Saudi FETP was notified through General Directorate of Health Affairs in Mecca about an ongoing uncontrolled measles outbreak in one of the detention centers among prisoners from different nationalities. So we investigated to describe this outbreak, and the aims was to assess the magnitude of the outbreak and also to identify the associated risk factors. In the methods, this was a descriptive study followed by an unmatched case control study. A structured questionnaire was used to collect the data, and cases were described by person, time, and place. In multivariate analysis, we are also used to find the independent variables that are linked to this outbreak. Odds ratios and confidence interval were calculated. We identified 165 cases, 65% of them were females, and we recruited 251 controls. As you see here in this epic curve, it shows a propagated pattern, although the mass vaccination was started early in the outbreak, but the outbreak was continuous till the end of October. So there are many challenges in controlling this outbreak. So pleased to know more about the challenges and also the risk factors that were associated with this outbreak. I'm glad to invite you to visit my poster number 16. Thanks a lot.
Thank you so much. Next, we're going to the Philippines with Dr. Carla Manahan, who will speak to us about a pilot study on the establishment of jail-based early warning systems to detect disease outbreaks among jails of the Bureau of Jail Management and Penology in Calabarzon, Philippines, 2021.
Thank you. Good evening. This is the pilot study on the establishment of jail-based early warning system to detect disease outbreak among jails in Region 4A, Philippines. Aside from Republic Act number 11332, or the mandatory reporting of health events should be complied, this study was conducted because I am a jail officer working in the Bureau of Jail Management and Penology for 12 years. Outbreak in jails is not only a public health concern, but a security as well. It is conducted to establish, implement, and monitor a jail-based early warning system. It is a developmental study conducted in 21 jails. We utilize purposive sampling. The study is divided in pre-implementation, implementation, and post-implementation phase. For the result, an event is defined as occurrence of illness that raises concern. There were 10 health events captured by the system in 5 jails. Top events were influenza, followed by food and waterborne diseases. Reports were verified and recorded. Upon submission of report to local health unit, they acted promptly and provided response. The research suggests that implementing a jail-based early warning system can be established and implemented and monitored in jails. JBUS was implemented nationwide 2 months after I reported back in the BJMP. The study provided a strong public health impact, such as rolled out training nationwide, issuance of memorandum to implement JBUS, and designation of epidemiology and surveillance focal person for 18 sub-national offices, and captured a total of 13 outbreaks where local health unit and the BJMP acted appropriately to halt disease transmission. I would like to end this by saying that the establishment of an early warning system in jails can effectively capture health events to initiate public health responses. Please come to my poster to discuss more about disease surveillance in jails. Thank you.
Thank you. Next up, we're going to Indonesia. Mrs. Tutik Inaya Susilangin Singh, apologies, will speak to us about a Hepatitis A outbreak investigation at an Islamic boarding school in Central Java, Indonesia. Welcome.
Good evening. My name is Tuti Inaya Susilaningsih, FETP resident of Universitas Gadjah Mada from FETP Indonesia. Thank you for having me to present our field project with the title Hepatitis A Outbreak Investigation at Islamic Boarding School in Kebumen, Central Java, Indonesia. Globally, more than half of hepatitis infection are hepatitis A virus. Although the incidence of hepatitis A in Indonesia is low, hepatitis A outbreak still occurs sporadically in Central Java province. On June 29, 2022, an acute jaundice case at an Islamic boarding school was reported to Allian Public Health Center in Kebumen. No case has ever been reported in this school of around about 200 students. An epidemiological investigation was carried out to confirm the event, identify the risk factors, and provide recommendations to control the outbreak. We conducted active case finding for 2 months and followed by 1 to 2 case control study, collected serum sample from symptomatic persons and tested for hepatitis A, drinking water source sample tested for water quality and logistic regression, estimated adjusted odds ratio. In the result, 47 cases out of 232 persons identified, and we found a risk factor that is shown in this picture. To learn more about our investigation, what is the risk factor that we found, and control measure we implement, please come visit my poster, number 4, and I hope we have the nice discussion. Thank you for your attention.
Next, we're off to Canada. Ms. Janice Hung will speak to us about locally acquired typhoid fever cases spanning 4 years linked to chronic carrier in Ottawa, Canada, 2018-2022.
Good evening. So my poster presentation describes an investigation into an outbreak of typhoid fever that took place in Ottawa, the capital of Canada, a city of just over 1 million people. Cases of typhoid fever are uncommon in Canada and are usually associated with travel to endemic regions of the world. In November 2021, we identified a link between 2 recent typhoid fever cases to the same grocery store ready-to-eat counter. Neither of these individuals reported recent international travel. Whole genome sequencing confirmed that these 2 cases were related and identified 2 other related cases from 2018 and 2020. How were all these cases related across all these years? We started investigating to identify the source of the outbreak and to implement control measures. I wanted to highlight some of the challenges we faced in this outbreak investigation. So the primary challenge of this investigation was the length of time between cases and the small number of initial cases, which really limited the amount of information that we could gather. In addition, we did not detect Salmonella typhi in any food samples. We screened 3 food handlers whom we identified as working at the ready-to-eat counter. However, stool samples from all 3 were negative for Salmonella typhi. To learn about how we overcame these challenges and about the role of social network analysis in solving this outbreak, please visit my poster, number 19. Thank you very much.
Thank you. Now let's call Mr. Gamade Dege to speak to us about an investigation of the cholera outbreak in Lacs District, Togo, November 2021.
Hello to all. I'm Gamade Dege. I present some very interesting work that our team of graduates in FETP Intermediate Togo carried out in November 2021 in the Lac Health District. It was an investigation of a disease which remains a public health problem in many developing countries, cholera. Everything started on November 5, 2021, when the regional laboratory confirmed the presence of cholera in a stool sample. Our team deployed and identified 8 more cases in the community, including 3 deaths that occurred within 6 days before the detection of the index case. In total, our investigation documented 37 suspected and 11 confirmed cases, and 4 deaths, including one that was confirmed as cholera. We identified some factors related to cholera cases that favor the spread of the epidemic and address them to break the chain of transmission. You will have even more interesting information to discover if you visit my poster number 17. See you soon.
Thank you. Next up, Dr. Saratuya, oh my goodness, my apologies. Wangsung Wanfon from the Thailand FETP, Thailand Department of Disease Control, speaking about a large thyrotoxicosis outbreak from chicken consumption in a prison in northeast Thailand, April 2022.
Good evening, everyone. Thank you for having me. And tonight, I would like to share with you an investigation on a thyrotoxicosis outbreak in a prison in northeastern Thailand. So thyrotoxicosis is the clinical state of hypermetabolic resulting from excess thyroid hormone actions. Outbreak of thyrotoxicosis have occurred from eating meat containing thyroid tissue. Several outbreaks occurred in Thailand prisons, and some inmates were hospitalized. In April 2022, the Provincial Health Office notified us about a group of 6 inmates who were diagnosed with thyrotoxicosis. We investigate to verify diagnosis, describe cases, and determine the scope, magnitude, and sort of the outbreak, so we could provide recommendations to control this outbreak and prevent the next one. Our investigation has 3 parts. In our descriptive study, active case finding was done in the prison. We conducted physical examination on inmates with symptoms and collected blood samples to confirm the cases. We found 214 cases among 3,052 inmates, accounting for a 7% attack rate. The cases were distributed similarly regardless of sex, age, duration of imprisonment, or building they were in. Most of the cases ate 3 daily meals from the main kitchen. A few inmates purchased meals from another prison kitchen. The information we learned from the interview and the meat sample help us identify the most likely source. The prison removed this source and no more cases were reported. Our findings suggest the prison to improve the food inspection process and establish a health surveillance system for early detection and reporting. For more detail on these findings, please visit the poster number 3. Your thought and feedback will be really welcome. Thank you.
Okay, now off to India. Dr. Ayanava Basu will be speaking to us regarding a cholera outbreak in a municipality in western Bengal, India, May to April 2022. Dr. Basu.
Thank you. Hi, I am Basu from WHO India. I'm here to present a cholera outbreak in West Bengal, a Hooghly district in the eastern part of India, highlighted in red in the map. If cholera has a home, it is the Gangetic Delta in India and neighboring Bangladesh. The original reservoir from where it spread across the globe in 19th century. This particular municipality is a densely populated old industrial town which lies just beside Hooghly River in this delta. And this particular municipality has not reported any cholera outbreaks for a decade. On 18th of April 2022, suddenly there was a report from this municipality that is suspected cholera cases were there. More than hundreds were affected There were deaths. The district health authority, they declared an outbreak. The very next day, we joined the investigating team. We searched house to house to identify cases. We interviewed the cases. Also, we reviewed records and did environmental investigation in the water supply lines. To understand what was the cause of this outbreak and how we controlled that, please join me in poster number 14 in the hall. Thank you.
Dr. Camille Jacqueline from the Spain UFAM program will speak to us about circulation of fluoroquinolone-resistant strains of Shigella sonii and Shigella flexneri in Spain, 2015 to 2022. Welcome.
Thank you. In February 2022, the European CDC published a rapid risk assessment about the increase of extensively drug-resistant Shigella sonii infection in Europe. They recommended all affected countries to increase their surveillance of Shigella species. In parallel, WHO raised fluoroquinolone resistance in Shigella species among the serious antimicrobial resistant threats. Therefore, our goal was to study the circulation of fluoroquinolone-resistant isolates in Spain and identify the genetic determinants of resistance. We used these diffusion methods to identify the resistant isolates and whole genome sequencing to study the resistome and identify genetical clusters. We found an increase of fluoroquinolone resistance in both Shigella sonii and flexneri since 2015. As much as 88% of Shigella sonii isolates were resistant in 2022. We also found that most cases were male from 16 to 60 years of age, and 21% of the cases were hospitalized, but no death was reported. Our core genome MLST analyses show a high genetic diversity in Shigella flexneri, but a low genetic diversity in Shigella sonii, with only 2 big clusters, one associated with the outbreak of 2021-22. So if you're interested to learn more about our microbiological approach to Shigella surveillance in Spain and learn about the implication of our study, please come and find me to poster 20. Thank you.
Now to Brazil. We're going to hear Dr. Matthews Glenn speak about an outbreak of Mycobacterium abscessus, subspecies abscessus, associated with cosmetic surgeries in the Brazil-Paraguayan border region, a binational investigation, 2021 and 2022. Welcome.
Good evening, everyone. In April 2022, the Brazilian International Health Regulation Focal Point detected a rumor about infections caused by rapidly growing Mycobacteria in cosmetic surgery patients. According to preliminary information, the surgeries were performed by a single surgeon in a private hospital in Pedro Juan Caballero, Paraguay, an international hub for cosmetic surgery located on Brazil's western border with Paraguay. Because these rumored infections could have affected patients in both countries, FETP Brazil and FETP Paraguay coordinated a collaborative binational outbreak investigation. Together, our objectives were to confirm the outbreak, control the transmission, and analyze associated factors. We conducted a retrospective cohort study among people who underwent cosmetic surgeries performed by the referred doctor between August 2021 and April 2022. We conducted telephone interviews, reviewed medical records, and tested surgical wound biopsies for etiologic agent identification and antimicrobial resistant testing. Confirmed cases were defined as symptomatic cases that tested positive for Mycobacterium abscessus. To learn more about how we investigate and what we find, we invite you to visit our poster, number 12. Thank you.
Now, Dr. Tawfiq Hakim Nazri will be speaking about a COVID-19 outbreak investigation in a prison, Afghanistan 2022. Dr. Nazri comes from the Afghanistan, Tajikistan FETP. Welcome.
Good evening, everybody. Thanks for introduction. I'm going to present an outbreak of COVID-19 in a prison. I use this one. In west part of Afghanistan, Herat province, which is located in west part. The outbreak was, as of April 2023, there was over 200,000 confirmed cases recorded in Afghanistan, with 7,884 deaths. As you know, health concerns are common in prisons. This investigation was aims to elucidate descriptive features of this outbreak. It's not going ahead. The methods was used. The notification was received from unexpected increase of the cases of ARI from on 14th July. From this prison, 5 teams of surveillance support teams, which are acting as rapid response team, like rapid response teams in Afghanistan, assigned to investigate and control the outbreak. Nasopharyngeal swabs was collected and sent for analysis for presence of COVID-19. Data analysis was performed by EPN47, and for the outbreak was peaked on 20 July 2022, and that's declined on 2nd August 2022. And I'm inviting you for details and other results to visit, please, my poster presentation on number 10. Thank you very much.
Thank you. Okay, off to Tunisia. Dr. Sonia Dawadi from the MedPed program in Tunisia will speak to us about long-term health effects of COVID-19 in Tunisia 2020-2021. Welcome.
So I am Sonia, MedPed fellow from Tunisia. So I'm here to present my poster about long COVID in Tunisia 2020-2021. So in Tunisia, from March 2020 to September 2021, we recorded more than 700,000 cases and more than 25,000 deaths, while the majority of patients recover from the acute SARS-CoV-2 infection. Some of them reported ongoing symptoms referred as long COVID. So we aimed throughout this study to estimate the prevalence of long COVID and to identify the determinant. For this, we conducted an analytical cross-sectional study with telephone survey among a representative sample of COVID-19 positive cases confirmed between September 2020 and September 2021. For this, we use an adapted definition between CDC and WHO, and long COVID was self-reported and defined as having at least one symptoms for more than 4 weeks and without any alternative diagnosis. So the prevalence among the 416 recruitment participants was 64%. If you want to know more about the determinant, the main results, and the public health recommendation, please do not hesitate to visit my poster number 21. Thank you.
Thank you. Next up, Dr. Yanis Turisinov will speak to us about surveillance evaluation of COVID-19 pharmacovigilance in Uzbekistan 2022. Dr. Yunus is from Uzbekistan and the Central Asia Advanced Tier FETP.
Good evening. COVID-19 vaccines are safe and effective. Vaccine-safe monitoring systems have ensured safety of COVID-19 vaccines, but gaps might exist in vaccine safety monitoring in limited resource settings. So, identify gaps in pharmacovigilance surveillance. We conducted an evaluation in on Kocaeli district, Uzbekistan, with population 120,000 people. In April 2022, we reviewed COVID-19 vaccination policy documents and analyzed surveillance data. We interviewed healthcare providers responsible for vaccination to assess their knowledge and practices related to adverse events following immunization AA5. Of the over 78,000 people vaccinated, how many adverse events were reported? Of the 1 in 5 providers encountered a severe AA5, how many reported into the system? Come to poster 9 to learn more. Thank you.
Thank you. Next, Dr. Trang Chavu will speak to us about within-household SARS-CoV-2 transmission and vaccine effectiveness during a COVID-19 school outbreak in Vietnam, September to December 2021. Dr. Chavu comes from the Australia FETP program. Welcome.
Okay. Thank you. Good evening. My name is Chang. I'm from Vietnam, but currently I'm studying Master of Applied Epidemiology in Australia. And today I would like to present with you our study about the within-household SARS-CoV-2 transmission and vaccine effectiveness during a COVID-19 school outbreak in Vietnam, September to December 2021. So we report the first 3 school outbreaks in Vietnam during a Delta variant epidemic after reopening school in September 2021. And we hope that the finding can inform the evidence-based strategy for school closure, vaccine prioritization, COVID-19 management during the school setting. So go a little bit more detail into the method. We conduct this as a retrospective cohort study in 150 students and 540 household contacts. We assess the transmission of students to their household. We also look into the vaccine effectiveness and the factor associated with the COVID-19 infection among the household contacts by using the multi-variable, multi-level regression analysis. Okay. So please come to see my poster at number 5 to see what is the transmission rate of students to the household contact, what is the vaccine effectiveness among the household contact of infected students, and what are the risk factors that for the COVID-19 infection among the household contact. Thank you.
Next, Mr. Vadim Rata from Moldova, the Eastern Europe and South Caucasus FETP will speak to us about factors and barriers influencing COVID-19 vaccination among healthcare workers, Armenia, Georgia, and Moldova, 2022.
Ladies and gentlemen, good evening. I would like to present our results of cohort field work, FETP. factors and barriers influencing COVID-19 vaccination among healthcare workers in Armenia, Georgia, and Moldova. As you know, COVID-19 pandemic remains a public health problem, and one of the methods to control the pandemic is vaccination. Especially the vaccination of healthcare workers is important that for sustaining healthcare capacity and avoid the spread of infection in healthcare facility. In the same time, healthcare workers with negative attitude toward the COVID-19 vaccination are generally less likely to recommend the vaccination. Therefore, we decide to conduct a survey to identify factors contributing to the decision to get them vaccination against COVID-19 and barriers to vaccination among healthcare workers. So, we perform a cross-sectional survey in Armenia, Georgia, and Moldova in summer 2022. We interviewed more than 1,200 healthcare workers from 168 healthcare facilities. As results, we can say that one of the positive factors that we identify was the desire to protect themselves. And one of the negative factors that they identify was the concern that COVID-19 is not tested. So I invite you to learn more about our methods that we use and what factors and barriers we have identified in our survey. Please visit our poster number 18. Thank you for information.
Next, Dr. Yang Pham will speak to us about factors associated with rabies post-exposure prophylaxis in high-burden districts, Central Highlands region, Vietnam, 2020 to 2022.
Thank you. Good evening, everyone. My name is Yang. I'm from FETP Vietnam. So I'm a rabies surveillance coordinator in the Central Highlands region. As you know, rabies is a zoonosis, and vaccine uptake after dog bite or post-exposure prophylaxis PEP is the only way to prevent rabies. So the Central Highlands region has the highest rabies mortality rate in Vietnam, 3 times higher than the national average. And people there have a habit of raising dogs to keep their house safe. A question was, what explains the high number of rabies deaths in this region? Therefore, we conducted a cross-sectional study and interviewed villagers who were bitten by a dog about their knowledge, attitude, and practice on rabies prevention and use of PEP. The study was in 2 rabies high-burden districts of over 71,000 people to estimate the number of dog bites and identify factors related to rabies PEP. Surprisingly, we found a very low level of completed rabies PEP as compared to 90% national target. And we identified 3 factors that could explain incomplete rabies PEP in the Central Highlands region. From that, we recommended 2 approaches to improve rabies PEP among the communities. So welcome to our poster number 6 to know more about our study. Thank you.
Thank you. Next, Dr. Umar Dumbaya will speak to us about an investigation of anthrax outbreak, Sierra Leone, May 2022. Mr. Umar is from the Sierra Leone FETP program. Welcome.
Good evening, ladies and gentlemen. District surveillance units received 5 suspected cases of anthrax on the 5th May 2022, and 4 cases from Karine district and 1 from Kailam district. I was deployed to investigate this event within 72 hours. And the objective of this investigation was to determine the magnitude and the scope of the anthrax outbreak. The following were done. We interviewed case patients, family, relatives, and healthcare workers, and we collected blood sample and swab specimen from the people. We conducted active case search within and nearby communities. Our findings: we identified 10 healthcare workers and 17 family relatives as suspected cases. For more details of Sierra Leone anthrax outbreak, please visit my poster, number 8. Thank you.
Next, Mr. Maxwell Mabona will speak to us about knowledge, attitudes, and practices of referral regarding animal bites and prevention of human rabies among traditional health practitioners. South Africa 2022, Mr. Mabona is from the South Africa FETP.
Thank you very much. Good evening. My name is Maxwell, and our poster summarizes our study that looks at knowledge, attitudes, and practices among traditional healthcare practitioners regarding rabies in one of the districts in South Africa. So we know that rabies is a zoonotic disease that we mostly get from animal bites. We also know that even though it is almost 100% fatal, it is 100% preventable through a post-exposure prophylaxis vaccine. The eThekwini district of KZN has a huge rabies problem. The biggest reason why we have that problem is that people there, after being bitten by an animal, seek care from traditional health practitioners, the ones that throw bones and tell you about your future, before they consider going to a doctor, a clinic, or a hospital. And unfortunately, the more post-exposure prophylaxis is delayed, the higher the chances of you developing full-blown rabies and dying from it. What did we do? We conducted a cross-sectional analytical study where we surveyed more than 200 of these traditional health practitioners in this problematic district. We wanted to understand how much do they know about rabies, what are their attitudes, what do they normally do when they find a patient who presents to them with an animal bite history. How willing are they to work with us such that they see the patient and then they refer them to us at least on the same day for life-saving post-exposure prophylaxis. The biggest aim of our study was to try and bridge the gap between traditional health practitioners and our clinic doctors and hospitals. And I'm happy to say that through this study, we gained very meaningful insights from these traditional healers on how we can bridge that gap and control rabies in this district of KZN. Please do visit my poster to find out more. Thank you.
Thank you. Next, Ms. Zoe Baldwin from the Australia FETP program will speak to us about the first incursion of Japanese encephalitis virus in New South Wales, Australia, 2022.
Good evening. Japanese encephalitis virus, or JEV, is a viral zoonotic disease spread by mosquitoes. In the summer of 2022, Australia experienced a substantial change to the known geographic distribution of JEV following a multi-year La Niña period with some of the wettest conditions on record. In Australia, JEV had previously been isolated to the Torres Strait Islands and northern parts of the Cape York Peninsula, but authorities had identified evidence of JEV occurring thousands of miles south of the known risk area, a distance equivalent to Atlanta to Los Angeles. An outbreak was declared on the 4th of March 2022. This required substantial public health response, given most of Australia's population would not have significant immunity to JEV, either from prior infection or vaccination, because the virus was not endemic to mainland Australia and vaccination was not routinely recommended to the general population. Less than 1% of people infected will develop clinical disease, and having never detected JEV in the state of New South Wales before, we therefore had very little information available to estimate how many people had been infected in the outbreak. We undertook a cross-sectional serological survey in 5 towns across New South Wales to ascertain the seropositivity of residents and to inform public health policy, interventions, and public messaging. Using convenient sampling, we invited adults and children to provide a blood sample and complete a questionnaire about possible risk factors for infection. So, what did our study find? Please visit my poster later to discuss the results and subsequent public health recommendations. Thank you.
Next, Dr. Bhavesh Rajaput will speak to us about risk factors of Cassandra forest disease in a district in India, January to June 2022. Dr. Rajput comes from the India EIS program.
Namaste. So, many of you might not have heard about this disease ever before. Some of you might have heard about it in your textbooks. I am here to share my experience with this disease, which I developed while investigating a cluster. So this disease is reported exclusively from India, and it is a tick-borne viral disease with multiple zoonotic hosts. And in humans, it causes a febrile illness with crippling weakness and a mortality of 3 to 10% if left untreated. It was first discovered in the Kyasanur forest of Shimoga district in 1957. And since then, it has slowly spread to cover 15 districts across 5 states. Okay. And sadly, even today, it haunts the people of Shimoga with seasonal outbreaks. Stakeholders across multiple sectors have joined hands to develop preventive strategies targeted at vaccination, tick control, and community awareness. We investigated a cluster of lab-confirmed cases in Tirthalli sub-district to describe the epidemiology and identify the risk factors, which included like exposure to dead monkeys, exposure to ticks, and exposure to gaps in community awareness. I welcome you all to come visit poster number 15 to discuss the complex nature of zoonotic disease prevention and control. I welcome you all to come visit poster number 15 if you want to try pronouncing the title correctly. Thank you.
There's a challenge. Now, Dr. Tsitsi Makanyanga will speak to us about HIV testing among men who have sex with men in Harare, Zimbabwe, 2021. What are the barriers? Dr. Makanyanga comes from the Zimbabwe FETP program. Welcome.
Thank you and good evening. Globally, the HIV incidence is high among men who have sex with men. The UNAIDS set HIV treatment targets in an effort to end AIDS by 2030, which included HIV testing as a critical point to accessing HIV services. In Zimbabwe, fewer men who have sex with men knew their HIV status against a higher prevalence of HIV in this population, despite the country's efforts to include key populations in HIV prevention strategies. This study has been conducted in a setting where stigma towards same-sex relationships still exists. It was against this background that we determined barriers to HIV testing. We conducted an analytic cross-sectional study among 329 MSM aged 18 years and older. A snowballing sampling technique was used to recruit participants. Initially, 10 MSM were identified through key population organizations, and they referred us to more MSM using a coupon system until the sample size was reached. Interviewer-administered questionnaires were used to collect data. The graph shows demographic characteristics among MSM in Harare. To learn more about barriers to HIV testing among MSM, please visit our poster 11. Thank you.
And our last stop for the evening, Ms. Nanael Jonas from the Tanzania FETP program will speak to us about anemia and associated biomarkers among pregnant women in Mbeya, Tanzania, 2020.
It is a good evening, ladies and gentlemen. So how about we wrap it up by talking about anemia in pregnancy? So global prevalence of anemia as reported in in 2019, among pregnant women was 37% globally, and in Africa it was 41%. In a study done in southern Tanzania, where Mbeya is located, the prevalence of anemia in pregnancy was 46%. So it's a serious public health problem. Now, many studies or several studies have been done looking at the risk factors of anemia. So we thought to look at the biomarkers of anemia because we wanted to know what is it that we're not doing to curb this problem. So a survey was done between September and October. Between September and October 2022 by the Tanzania Food and Nutrition Center to determine, among other things, the micronutrient and infection biomarkers associated with anemia. So, excuse me, I'm trying to go back. Yes, there we are. So the aim of this study was to look at this nutritional and infectious biomarkers that are associated with anemia in the region. So this study employed random systematic sampling to obtain the health facilities as well as the participants to include in the study. And these pregnant women were given semi-structured questionnaires and they submitted blood samples for the biomarker testing. And we found that 26% of the women were actually anemic, with majority of them having moderate or mild anemia. But we also find that majority of these women were below the cutoff points for the micronutrients that we were testing. So we asked ourselves a very important question that I think you would want to know. What is the risk group in this anemia? So if you would like to learn more about the study and the recommendations, please visit my poster, poster 13, and I'll be waiting for you eagerly.
Well, after all those teasers, you're wondering, how do we see the posters? Right through the back, you'll be able to access the poster hall. Please remember to return to this space after closing for the group photo, and we will see you back here when we are done. Welcome to the posters.